I'm a designer. Now, what comes to your mind when I say design? Often people say, "Oh, you make things pretty," which yes, I guess that can be true. But that stereotype confines designers to the purely visible and makes design an afterthought. Recently, I have witnessed how design can be implemented in every step of creating or redesigning processes, services, and systems. This type of design is called service design. Service designers coordinate and organize tools and people to ensure that the user has a seamless experience. So to understand the impact, imagine that there are two coffee shops right next to each other, which actually is quite typical in Vancouver. They sell the exact same coffee at the exact same price. Service design is what makes one of these coffee shops your favorite, the one you go to all the time. But service design can apply to any industry. My hope for the future of Canadian healthcare is to incorporate service design because it can enable us to put patients' care first while ensuring that the system is also working for staff. In the healthcare context, for example, a service designer could optimize the process of getting an X-ray. We would focus on the end-to-end process, from getting a referral to booking an appointment, to going to the appointment, to getting results. We would also investigate the emotions felt by the patient and the feedback needed to reduce anxiety. We would also take into account how the system looks on the back end. Who does the referral and how do they do it? What information does the X-ray tech see? How can we make this process more seamless for everyone? So today, I'm going to share why healthcare and service design make a perfect match and uncover this love story. Now let's take a step back and think about what love stories require. First, the partners need some commonalities to bond over. By having similar philosophies of life, they can reach the same goal. Healthcare and service design both want to help people. Healthcare is patient-centered, and service design is user-centered. Successful service design thinks of the user's needs and takes into account environmental factors. In healthcare, often the user is the patient, but patient care is affected by so many people: nurses, managers, maintenance staff, doctors, educators, dietitians, and even policies involved. Service design can think at a wide scope, but with the patient ultimately in the center. Thus, both healthcare and design are driven by empathy. So that's great. We have a common goal between the two partners, but for attraction, like in many classic love stories, think Romeo and Juliet or Bridget Jones and Mark Darcy, opposites attract. Opposing characteristics help partners learn from one another and grow together through their differences. So for our first opposite, healthcare is complicated. There are hierarchies between stakeholders and important safety and data protection needs. These both affect and ensure that complex care plans are managed well. Meanwhile, designers like to organize and make sense of ecosystems by creating diagrams. We map out processes to unpack how systems work. These diagrams can show the touch points at each step, the people involved, and how these people feel. By mapping out the sometimes chaotic and unpredictable systems, design opportunities emerge. Another opposite is the type of data that both partners use to make decisions. Healthcare predominantly relies on quantitative research, while service design relies on qualitative research. Healthcare gathers data through clinical trials and various studies. In principle, only things that are statistically significant or scientifically proven are approved. But in many circumstances, this is crucial because people's lives are at stake. But this belief can be limited. Healthcare is all about helping people, and people are not as rational as scientists would like to believe. Therefore, service designers rely on qualitative research to ensure that the system works holistically beyond the numbers. We talk to people to capture stories, observe what people do, and spot out when their actions don't line up with what they say. Doing qualitative research also enables us to make experiences more than adequate. We can add delights where people don't expect it, like when a child receives a colorful sticker after an appointment and it makes their day. Let's not just make services that work, but experiences that are as good as they can get. A third opposite is that healthcare is wary of risk and therefore moves slowly. Risk is not an option, and safety cannot be jeopardized. This is rightly so when patient survival depends on it. But when changes need to be made, service designers offer different ways of testing low-cost ideas. We simulate situations so that it is not risky through role-playing. We assign characters to individuals and go through different scenarios to see how processes would work and what problems may arise. We do this to perfect the service before it goes live and enters the real world. This enables us to save money in the process as well. So, if there's anything I want you to take away today, it's that design can offer more than making something pretty. My hope is that we can use service design to make healthcare better for everyone, both patients and staff. The next time you're working on a healthcare project, like making your clinic more inclusive and accessible, figuring out how to decrease food waste in hospitals, or creating an online process for patients to follow, think about swiping right on a service designer. Thank you.